Meanwhile, the House of Representatives will vote today on the revised plan to repeal and replace Obamacare. Lawmakers are debating the bill right now ahead of an expected vote this afternoon. It gained the support of GOP holdouts after an amendment added billions to cover costs for people with pre-existing conditions, and Republican leadership is sounding confident in its chances.
Was there any feeling that you might have any last-minute surprises here? We heard a few undecided still leading this meeting.
We'll have the votes. This will pass.
Today we start the process of rescuing the American people from the failures of Obamacare. And of course, if you look all across the country at what's happening, what happened in Iowa yesterday, where literally 95 out of 99 counties won't have any options for health care. This law is failing. This law is in a death spiral. And our bill actually rescues families by focusing on lowering premiums and putting people back in charge of their health care decisions. I think you're going to see a proud vote today on the floor by a bunch of members ready to go and rescue people from the failures of Obamacare.
Well, we want to welcome in Tevi Troy. He was Deputy Secretary of Health and Human Services under President George W. Bush, and he joins me now from Washington. Tevi, thank you so much for joining us. So given your experience in this field, do you think this bill, as it's written now, is a good thing for the American people?
I think this bill has made a lot of progress from where it was the last time. I think the members of the House GOP caucus spoke and they said, we have some concerns about the initial draft, meaning it didn't cover people with pre-existing conditions sufficiently, and it also wasn't sufficiently transformative. I think they took some important steps over the last 3, 4, 5 weeks to make changes to the bill, to make it more transformative, so states can now do more experimentation, and if they don't do the experimentation, then the protections from the previous system are still in place. And then at the same time, you also have this additional money for pre-existing conditions so that people can join high-risk pools. So I think there's been some real improvements to the bill.
So let's talk a little bit about that. That money is about $8 billion. It's a lot of money. The Senate Minority Leader said that the change was like administering cough medicine to someone with stage 4 cancer. Do these high-risk pools actually work? Just to explain, this additional money is to help people who have pre-existing conditions pay for presumably more expensive insurance.
Yeah, well, I'm sure he enjoyed that rhetorical flourish, but I don't like throwing around the term cancer lightly. I think that pre-existing conditions are helped with the high-risk pools because you let the people who have the sickest and the most difficult situations get some kind of help. Right now with the Affordable Care Act, and we've heard about the problems in Iowa, what the Affordable Care Act actually creates is higher risk pools. So everybody joins this higher risk pool because a lot of people who joined in the Affordable Care Act in the exchanges, they happened to be sicker than anticipated, and not as many healthy people joined as we would have wanted to see. So this creation of the high-risk pools actually does cabin off the sickest people and allow the healthier, more robust risk pools to develop. So I think that's a good development.
And there's some states that already have high-risk pools. Are they working in those states? Are these people able to get the type of health care that they can actually afford, not just having health care, but health care they can afford?
Yeah, so we have seen some positive developments in high-risk pools in the past, in Maine, for example. The Affordable Care Act, however, tried to get away from high-risk pools, so it's not really a complete fair experiment at this point. But I think under this new legislation, you would be moving back towards a system where states could develop the high-risk pools that could work, and again, Maine was a positive experience.
So the bill is being debated right now on the House floor. The Congressional Budget Office still has not added up the estimated cost for this bill. Is that something you think lawmakers should be weighing as they consider voting?
Yeah, obviously the Congressional Budget Office, the CBO score, is very important. I remember the Affordable Care Act. There were multiple iterations and then multiple CBO scores, and the CBO score kept changing based on this change or another. So that is typical to see changes in legislation, and then that leads to changes in CBO scores, but CBO can't always score the bill as quickly as you might want. I think what we saw in the initial score was that the proposal would reduce taxes, reduce spending, and reduce the size of the deficit. I think, I haven't seen the CBO score yet, or nobody has, I think that this iteration would continue to do that, but it would have more protections for people with pre-existing conditions, so it would alleviate concerns on that front as well. But I look forward to seeing the score.
Okay, so this is just the first stop for this bill. If it passes the House, it has to move on to the Senate. What challenges do you foresee there?
Look, the Republicans have a 22-vote cushion in the House, right? If they lose 21 votes, they're still okay. In the Senate, they have a 2-vote cushion. So there's not a lot of running room. They really need to have their entire caucus on board. I think Mitch McConnell is an excellent legislative tactician, and he's been very good at holding the GOP caucus together when he needed to. But this is going to be a real challenge because it's not easy to do.
Lastly, Tevi, you'll recall all the criticism surrounding the Affordable Care Act at the time when it was passed. And, the argument was by Republicans that the process was rushed, that it was partisan. We really don't know what's in this bill. Can the same criticism be lodged against the Republicans? Now we're trying to get this bill passed before Republicans head out on their time off on recess. A lot of people, I don't think, have read the entire bill and know exactly what's in it. So are the Republicans basically guilty of doing what they accuse the Democrats of doing with the Affordable Care Act?
Look, votes often take place before a recess. That's not unusual. What's going on here is they're using the budget reconciliation process tool. This tool allows you to pass things with fewer than 60 votes in the Senate. It's as a result of the fact that the Democrats are not cooperating in any way on this endeavor. So they have to use the budget reconciliation process tool. That tool puts you in a twofold box, a box in terms of the amount of policy you can put into the proposal, but also there's a time limit on when you can get it done. So I think the fact that they're using the budget process reconciliation tool puts them in this particular time constraint.
All right. Well, Tevi Troy, we appreciate your time. Thank you.
Thank you.